Hello everyone, my name is Jenny and today I will talk about my research proposal, Hispanic pregnant woman with obesity. So the recommended weight during pregnancy will depend on the previous body mass index BMI. In the image, we can see the different weight gain for each woman who has a different BMI. For example, an underweight woman that is pregnant, they can gain 28 to 40 pounds. However, when you are obese, you only can gain 11 to 20 pounds. The pregnancy obesity in the US for Hispanic women is 28.9% to 32.4%, making the largest population with more obesity. Genes and cultural environment influence the weight gain in obese women, making this population more susceptible to develop preeclampsia after the week 20 and gestational diabetes in week 24. Obesity during pregnancy can affect the baby with congenital disorders, fetal macrosomia, growth problems, asthma, obesity, cognitive problems, and development delay. The research question is, in a Hispanic pregnant woman with obesity, does a structured exercise and diet program for 19 weeks between the 20 and the 39 weeks of pregnancy compared to no program prevent preeclampsia and gestational diabetes? Literature review say that obese women are more predisposed to develop preeclampsia and gestational diabetes. Preeclampsia is when pregnant women present high blood pressure and there are high levels of protein that can cause damage to the kidney, and this is called proteinuria. It also affects the function of the placenta. Some of the symptoms can be severe headaches, vision problems such as blurring or seeing flashing lights, pain just below the ribs, vomiting, sudden swelling on feet, ankles, face, and hands. When we talk about gestational diabetes, it's a type of diabetes that can develop during the middle of pregnancy, which can harm the mother and the baby, and is when your body can make enough insulin during the pregnancy. Some of the symptoms can be increased thirst, needing to pee more often than usual, a dry mouth, tiredness, and blurred eyes light. In the image in gestational diabetes, we can see how the mother and the fetus can be affected during and after the pregnancy. Additionally, research mentioned that Latina children are higher risk of developing obesity compared with other population. A cohort of 82 pregnant women were recruited in San Francisco General Hospital during the second trimester and the third trimester of pregnancy. 53.7% has excessive weight, and preeclampsia is developed when you have a BMI 30 or more. You can develop, yeah. It also a study of 11,825 women that gave birth in Kaiser Permanente, South California, found that Hispanic were taste for diabetes in 1 week to 6 months postpartum, which is greater than another populations. The design of the research is going to be a case control through observation. The participants will be recruited by inclusion criteria, and this is going to be you have to be a Hispanic pregnant woman with a BMI equal or higher than 30, and we are going to ask about age, socioeconomic status, cultural tradition, type of diet if any, and on type of exercise if any. The study we are going to compare obese women who follow a DASH diet and exercise to prevent preeclampsia and gestational diabetes in contrast to obese women who do not follow most or any nutritional recommendation and don't do the recommended exercise during pregnancy. I choose the DASH diet because the DASH diet, the participant is going to increase the consumption of fiber, fruits, and veggies. It also helps to the weight control. The food is going to be tracked in Chronometer app. That way we can have a better idea of what's the consumption of each participant. The exercise, it has to be 30 minutes every 3 to 5 days of aerobic exercise. The number of participants by G-Power is going to be a 64 Hispanic pregnant women in each group, which it's a total of 128 participants. The power will be 0.8 with an alpha error of 5%. The study is going to be conducted in an OBGYN clinic in the Hispanic area in San Diego, California. And the criteria, as I mentioned, the study is going to last for 19 weeks, starting the week 20 of pregnancy to the 39 of pregnancy. The data that will be collected will be age, report from Chronometer app, exercise, blood pressure, and glucose monitor. A consent form will be attached to the questionnaire, and the consent form will be included in the participation that is voluntary, anonymous, and confidential. The inclusion criteria is going to be, as I mentioned, they have to be Hispanic, obese, pregnant woman, BMI equal or higher than 30, and the pregnant woman has to be in the second trimester of the pregnancy. The exclusion criteria is going to be that any Hispanic obese woman who have preeclampsia, gestational diabetes, and other disease and high risk are excluded from the research. The questionnaire will be a response from rank question to determine which group is going to be compliant and not compliant. For the compliant group, they have to follow the DASH diet to record in the food intake in Chronometer, and they have to do exercise like walking, swimming, yoga, Pilates, anything that they can have problems with the baby. They have to record the weight gain, blood pressure, and glucose. The other group is going to be the non-compliant group, and they don't have to follow any diet program, but they have to record the food intake in the Chronometer app. That way we can have a better comparison from each one. The exercise, they don't have to do any exercise, or they don't comply with the recommended exercise. They have to record the weight gain, blood pressure, and glucose too. The possible result from this research will help to measure the benefits for obese Hispanic women during pregnancy to prevent the development of preeclampsia and gestational diabetes. Measuring the body weight, blood pressure, and glucose will help me to compare the difference between each group and what is the rate impact in each participant. The research question will be answered when the study finishes and the compliant group does not develop any preeclampsia or gestational diabetes. One of the challenges in the study will be to confirm that the compliant group is following the balanced diet and doing the recommended exercise. Thanks for hearing me. This is the words.